Hi, I'm Dr. Reubina, gynecologist and an IVF specialist, and welcome to Grace TV. Today on our show, we have Dr. Noopur, who's a very eminent and a prominent dermatologist. She's a director of Skin's S Clinic and has been seeing patients since last 10 years. So welcome Dr. Noopur, welcome to our show.
Thank you, Dr. Reubina. It's an absolute pleasure to be here.
Thank you. So you must be wondering why we have a dermatologist on our show today. PCOD is not only treated by a gynecologist, but also a multidisciplinary team should be involved in the PCOD management. A team which has a gynecologist, a team of nutritionists, endocrinologists, and a dermatologist. So we have Dr. Noopur on our show to discuss about PCOD and skin-related problems in PCOD. PCOD, we all know, is on a rising trend. Around 10 to 15% of patients suffer with PCOS in their lifetime. PCOS not only causes fertility problems, it also causes a physical disturbance and also metabolic problems. Fertility issues where patients are not able to conceive because of irregular periods, physical problems where they have acne, they have hirsutism, they have hair fall, and metabolic problems which leads to long-standing PCO, which leads to diabetes, hypertension, cholesterol problems, and increased risk to heart disease. So you all can now make out that why multidisciplinary approach is required in this. So WHO says it's all because of lifestyle issue, it's because of lack of physical activity and bad eating habits. International researchers have also shown that all of this PCOS has direct effect on quality of life. Quality of life of a woman. Imagine a woman who is suffering from PCOS, has gained a lot of weight, has a lot of acne on the face, and is suffering from hair fall. So tell us, Dr. Noopur, all of these patients who come to your clinic left and right, what is the mental state of such patients who are suffering from PCOS and all of these physical problems? The physical looks, all of these are involved. So what is the mental state of these patients?
Definitely, PCOD has a huge impact on the mental state of these patients because all the skin problems like the acne, the unwanted hair growth, the hair loss, they are very visible. Many patients, they come to me with their face completely covered because they are very embarrassed to show themselves. Unfortunately, this mental health part of PCOD is very neglected. We often just try to treat the symptoms or we try to treat the hormonal imbalances, but we don't really pay any attention to the mental health of the patient. You're very correct in saying that a counselor or a psychiatrist should also be a part of the team which is going to help in giving a holistic treatment to a PCOD patient.
Absolutely, that is very much required, and I think we all should, under a social awareness program, we all should also educate the patients about PCOS, its impact on the health, and what type of support doctors can give them is also what is need to be told them.
I think more than the patients, even the family members need to be
absolutely.
counseled.
The family members should be very supportive. See, I really feel that gynecological problem is very personal and it's not visible to the outside world. But problems like acne, hair fall, they absolutely destroy the confidence of these females, and when they come to the clinic, they are very, very depressed and anxious, and we all need to help them and support them with health and care. So tell us, what are the causes of hair fall, causes of acne and hirsutism in such patients? What is the background cause of it?
So even though PCOD problem is at the level of the ovaries have multiple follicles which are releasing male hormones. These increased male hormones in the blood along with an increased sensitivity at the level of the hormone receptors in the skin are responsible for most of the symptoms that we see. The common symptoms being acne, particularly over the jawline, the excessive hair growth on the face, hair loss on the scalp, and also some patients have discoloration as well as thickening of the skin on the folds along with skin tags. Yeah. So these are all related to the increased level of the male hormones in the blood.
So like you very correctly mentioned that it's the problem lies in the ovaries. So what happens in PCO patient is these ovaries become very thick. And also to add on the problem, these patients have increased weight gain. So fat is also a hormonally active tissue. Ovary also becomes hormonally very active, starts producing male-like hormones, and that is why the symptoms like excessive hair growth, acne, and hirsutism starts coming up. So majorly it is because of the hormonal imbalance. So you just told us about the causes. Tell us about the management of PCOS, the treatment part of PCOS. How do you manage and how do you treat this acne?
So treatment of PCOD can never be a standalone treatment by a dermatologist or by a gynecologist. It has to be a team effort.
Yeah.
My treatment is only going to work if the gynecologist or the endocrinologist is going to help in balancing the hormones as well.
Yes.
Because just by giving a symptomatic treatment, for example, just by treating a fever of a typhoid without giving an antibiotic is not going to help. Similarly, just by treating the symptoms like acne or hirsutism with laser is not going to give a long-term remission. A long-term remission will only be achieved once the PCOD patient changes the lifestyle, the hormone levels are under control, and that's when the results will be much better.
Absolutely. So unless the underlying endocrinological disorders is treated, the lifestyle modification is adopted, the cosmetic treatment would only be of temporary relief. So nowadays, Dr. Noopur, apart from the medical management, the lasers are also gaining a lot of popularity in the treatment of PCOS. So tell us more about lasers.
So lasers are definitely one of the best solutions for PCOD patients because they help in getting a permanent hair reduction. Having said that, PCOD patient, the results will be different from a non-PCOD patients in the sense that they might require more frequent sessions or more number of sessions. And the long-term remission, as I said, will only be achieved once the hormone levels are under control.
Yeah, absolutely. So are these lasers painful?
They are not painful at all. Nowadays, the machines, the lasers that we have, they are absolutely painless and they are absolutely safe.
Any risk of cancer with the laser?
Not at all, because the lasers, the wavelength of the lasers is such that it only acts at the level of the hair follicle, and that too just black hair follicle.
Oh, that is very nice.
As soon as it detects a black hair follicle, it removes that from under the skin. It doesn't go anywhere deep, it doesn't go into our tissues or into our bloodstream to be able to cause any kind of long-term side effects.
That's great. So what about the hair fall? What type of a treatment you give to the patients?
For the hair fall, we do have various treatment options from the medical management, like the use of topical minoxidil, the oral the biotin tablets, the hair nutrients, along with even oral finasteride is being used in certain women who have completed their family. Then treatments like PRP, the platelet-rich plasma therapy, in which we use the patient's own blood. We separate out the platelets and directly inject it at the level of hair follicle. That has shown wonderful results for hair growth. These will again only work if the PCOD treatment is going on side by side, because if the internal process is not halted, then the hair loss will also continue.
Yeah, absolutely. So Dr. Noopur has provided us with lots of useful insights about PCOS and associated problems. And all of these, and she has also told us that all of these are treatable. So now you know if anybody is suffering from PCOS or if you are suffering from PCOS, she's the right person to go to for any skin related problems. So you can call Dr. Noopur, you can meet her in her clinic, or you can also follow her Instagram page for daily skin glow updates. She keeps putting up all of those updates which are very useful. So today's take-home message is diagnosing the disease early, addressing the hormonal problems and changing the lifestyle, and consulting the doctors on time can solve the problem. So be watchful and continue watching Grace TV for more and more women health related updates. If you have any query, you can call us, you can email us, or you can log on to our website. We will be more than happy to help you. Thank you.